Demand on your care, medication management for older adults. Are anti-inflammatory drugs the same as antibiotics?
When we suffer from bacterial infections or inflammation, doctors may prescribe antibiotics or anti-inflammatory drugs for treatment. Many people often confuse antibiotics with anti-inflammatory drugs. But in fact, antibiotics and anti-inflammatory drugs are different drugs with different pharmacology. Let's look into the differences between antibiotics and anti-inflammatory drugs. Antibiotics. Antibiotics are mainly used to treat bacterial infections. When we're infected with bacteria, the bacteria multiply in our bodies, causing corresponding symptoms, including inflammation. Antibiotics can inhibit the growth and reproduction of bacteria, disrupting their metabolic pathways, and thus treating the infection and gradually alleviating inflammation. To prevent the development of antibiotic resistance, it's crucial for patients to complete the entire course of antibiotics. Common categories of antibiotics include penicillins and their derivatives, cephalosporins, macrolides, and tetracyclines, etc. It is important to note that antibiotics are not used to treat viral infections or inflammation caused by other non-bacterial infections, such as influenza. On the other hand, anti-inflammatory drugs can be divided into corticosteroids and non-steroidal anti-inflammatory drugs. Corticosteroids. Corticosteroids are a class of synthetic drugs used to suppress and alleviate inflammation and allergic symptoms, such as swelling, redness, and itching. Therefore, they are used in the treatment of inflammatory conditions and overactive immune system disorders. Corticosteroids come in various forms, including oral steroids like prednisolone for alleviating symptoms of rheumatoid arthritis and lupus. Inhaled steroids like budesonide for managing airway inflammation in asthma and chronic obstructive pulmonary disease. Topical steroids like hydrocortisone for controlling skin inflammation in eczema, allergic dermatitis, and psoriasis. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are a class of drugs with analgesic, anti-inflammatory, and antipyretic effects. NSAIDs work by interfering with the enzymes called cyclooxygenase, COX, in the body, reducing inflammatory responses, and achieving anti-inflammatory effects. Common NSAIDs include ibuprofen, aspirin, diclofenac, naproxen, celecoxib, and indomethacin. Among these, ibuprofen, available without a prescription which can be purchased at pharmacies under the supervision of registered pharmacists. These drugs provide pain relief and are often used to alleviate menstrual pain, muscle pain, and toothaches. Their clinical applications extend beyond pain relief to reducing acute and chronic inflammation, making them suitable for treating conditions associated with inflammation. In summary, while both anti-inflammatory drugs and antibiotics can alleviate inflammatory symptoms in certain circumstances, their mechanisms of action and applications are different. If you have any questions about medications, don't hesitate to consult healthcare professionals and pharmacists.
Please visit our website, Facebook, and YouTube channel for more information on elder care. Before you leave, remember to like and subscribe our channel.